Well, Social Security is a promise made to the people of America, and it's a promise made to me, promise made to you, promise made to everybody. And one of the things you'll find about me is that I keep my promises. And as a government, one of the things that we have to do is to keep our promises. Unfortunately, in Washington, they make far too many promises and then they break them. I am not that kind of a politician. As mayor of Miami-Dade County, when I made a promise, I kept it. Matter of fact, what I like to do is under-promise and over-deliver. And if we did that more often, I think Americans would be in much better condition. So it's a promise made. I will keep that promise. I will make sure that Social Security benefits are kept for seniors, and also assure that the younger generation is going to have a Social Security program when it's their time to enjoy these benefits. And I'm a fiscal conservative, but Social Security is not something that we're going to touch to try to balance budgets. It's something that we need to keep our promises. Simple as that. It's a promise made. It's promise made, and as your congressional representative in Washington, we'll keep that promise. Well, again, Medicare is another promise that we made to the American people. We have to make sure that the Medicare expenses are kept low. We need to reduce the incidences of fraud. We need to assure that seniors have access to also prescription drug prices that don't skyrocket. And so, as a member of Congress, we'll be looking at a way. We need to have a bipartisan effort, and that's one thing that I've known for here in Miami-Dade County, working together instead of working against each other. We can achieve, those benefits. We can reduce drug pricing. We can have transparency in billing, so you don't have surprise billing. We can also introduce competition amongst healthcare providers to lower the cost of Medicare, but always keeping Medicare benefits, the best in the world for our senior citizens. We have millions of senior citizens that rely on Medicare. I will rely on Medicare. I'm a senior citizen myself. My wife is a senior citizen. And so in this case, you're actually going to have somebody who's a beneficiary of these benefits. And I'll make sure that those benefits stay strong, but also we will find ways to reduce the costs so that we can, again, ensure that Medicare is available. The one thing I will not do is not vote for Medicare for all and put another 200 million people that are right now are funded through private insurance on a government-run system. That will lead to trouble. It will lead to trouble for not only the people that have their private insurance, but also lead to trouble to the people that are on Medicare and put undue pressure on the system that we don't have right now and frankly don't need to have in the future. Well, one of the things we need to do is pass a $200 billion forgivable loan program for businesses. It is a small business that is the backbone of the American economy. We need to make sure that small business can come back after we start to open up the economy. We struck a pretty good balance here in Miami-Dade County with safety and then trying to open up the economy. Safety always being the overriding factor, but it makes no sense. Some of the proposals that I'm hearing from my opponents to increase the tax rate for corporations and businesses. That makes no sense at all. You're disincentivizing those businesses that are the backbone of the American economy, that create the jobs that our senior citizens need and have had. And so we need to incentivize business to get our people back to work, to get our seniors back to work, and then restore the greatest economy of our lifetime. Regressive tax policy that disincentivizes business is the last thing that we need to do coming out of the COVID-19 crisis. And so I will be looking to incentivize businesses, not disincentivize businesses, to create those jobs and to help our older Americans. Well, it's competition, and we need to have more competition with the drug producers. We also have to ensure that generics are more available quicker. We also need to make sure that when you go into a doctor's office and they're about to prescribe something, that you don't get prescribed the name brand, which is a heck of a lot more expensive. If there's a generic, and it's your choice to which one you want. I want to cap the drug the $3,100 per year for drugs, and then have that also on a monthly basis, so that you don't have one month where you're going to pay a lot more than others. So we need a whole slew of different solutions. You need to look at why is it that the America drugs cost so much in America, and they don't cost that much elsewhere in the world. And so I support a measure to have America as the favored nation status. That means if you are a drug company and you're selling your drugs in America, that the American drug prices will be no higher than the lowest price paid anywhere else in the world. That's something that I support. That's something that we can do, and frankly, something I don't understand why we pay more than anybody else. Everybody should share in the cost of research and development. It shouldn't be just borne on the backs of the American. Well, the COVID-19 here as mayor of Miami-Dade County, the best thing we can do is keep our elderly safe. And so the first things that I did was I closed community centers where our seniors would be congregating. But when we did that, we didn't say, okay, you're on your own. No, we started a at-home meal program for all seniors here in Miami-Dade County. We have delivered millions of meals for our seniors so that they can stay safe at home. And that's what we did, and we've had excellent results here in Miami-Dade. We also did not, when there was a COVID-19 patient in a nursing home that went to the hospital, we didn't force them back into a nursing home. So one of the things that happened in New York that I think was catastrophic, it cost thousands and thousands of needless deaths. So that's those policies are the ones that we instituted here in Miami-Dade County. I want to make sure that the nursing homes themselves have access to testing, frequent testing, not only of the patients but also of the staff, so that the COVID-19 virus can be stopped as quickly as possible. If we detect something in a nursing home, we will take the appropriate action to isolate those that have COVID-19, give them the appropriate care at the appropriate level of care in the appropriate facility, not force them back into nursing homes. But again, what we've done here is we kept them safe by keeping them at home, but also making sure that they have access to food and services while they're staying at home, and those services will be provided by Miami-Dade County in the state of Florida. So that's how we treated the COVID-19 here with seniors, and like I said, I think we've had very, very good results.